Hola, muy buenas tardes, bienvenidos, buenas noches si hay alguien siguiéndonos del otro lado del charco. Mi nombre es Daniel Otzoy y tengo el gusto de presentar a mi gran amigo, colega en JSI, Steve Ollis, quien es un especialista en salud digital, Senior Digital Health Specialist en JSI. Con una experiencia de muchos años alrededor del mundo implementando sistemas de información para la salud. Desde hace un año, si no estoy mal, me corrige Steve, pues ha asumido el puesto de director también del proyecto CHISU, un proyecto financiado por la Agencia de los Estados Unidos para el Desarrollo Internacional USAID, el cual está teniendo un gran impacto a nivel global, especialmente en algunos países de África, en el este de Europa, específicamente en Serbia, y pues quisimos aprovechar la oportunidad y la amistad para invitarlo a cerrar este segundo día de conferencias, el cual ha estado muy intenso, sobre todo por el panel anterior. Así que bueno, un placer siempre estar contigo, Steve. Thank you very much for joining us, and the space is yours. Thank you very much.
Great. Thank you so much, Daniel, and the rest of the Rekinsa team. I really appreciate having the opportunity to be here. Let me go ahead and see if we can get the technology to work. Let me share the screen, and I'll get through the slides, and I'll do my best to keep up with what I know has been a very exciting conference so far. So let me share my screen, and we'll go here, and we will share. Okay, can I just get a check that you are able to see the screen?
Perfect.
Wonderful. Okay, so we're off to a good start. So thank you again. My name is Steve Ollis. I am the project director for CHISU, for Country Health Information Systems and Data Use. And Daniel was right. It has been just over 1 year since we started. So some quick facts about CHISU. This is a 5-year cooperative agreement. We started at the end of 2020. We plan to be in more than 20 countries around the world. We are managed from USAID's Office of Health Systems, and we are one of USAID's flagship data and health information systems projects. We are aligned with USAID's digital strategy, Health System Strengthening Vision 2030, and the Digital Health Vision. And we are one of the key conduits to realizing those visions and strategies in the countries where we work. So what is CHISU's vision? Our vision is country health systems in which stakeholders at every level can access high quality data generated from multiple interoperated data sources. And most critically, use that data to guide policy, improve resource allocation, service delivery, and systems performance. So you can see we're talking about freeing up data from just being available at the central level to being available at all levels of the health system, from the community to the facility to the subnational and national levels. We're talking about interoperability and having access to data from multiple sources, and then critically making sure that systems are not just digitized, and we think that we are done, but we are really focused on the data use and data use for action, for policy, and to improve system performance. We are organized around 4 strategic objectives. We start with governance, health information systems governance. So strengthening governance and the enabling environment of host country health information systems, the increased availability and interoperability of quality health data and information systems. Again, there's the data demand and use piece. Number 3, increased demand and use of health data and information to address health priorities, gaps, and challenges. And then number 4, critically, is strengthened organizational development of local partners for sustained health data use. So working to ensure that there is a robust ecosystem of partners, non-governmental partners, academia, private sector, that is available to support the digital efforts in the health information systems while CHISU is in place and after USAID funding may end. To achieve what we're trying to achieve takes a team. And if I may say so, I think we have a great team, but I admit I am slightly biased. So we are a team led by JSI. We have partners of RTI International, Vital Strategies, GEMB Health Systems, MacroEyes, and GemNet Health. And we have resource partners spread around the world. We have 15 different resource partners representing global and regional health information networks, leaders in human-centered design, data science, and the design and development of digital health tools. So what is our theory of change? As you can see, our vision is in the middle, access to and use of high quality data generated from multiple data sources. And to achieve this, we know we need to strengthen the health information systems governance through strengthening the governance systems and organizational procedures. We need to develop and use effective tools for governance. On the systems and software side, we need to focus on data availability, improving interoperability, and applying technological advances, tools, and data science approaches. For the data quality and use component, we need to strengthen the health workforce capacity and organizational processes, improve the use of health data, and develop better analytics, visualization, and interpretation tools. And then fourth, again, is that local capacity enhancement. And as you can see, all of these are related to each other. So strengthening governance should have an impact on systems and software. Improved data use and quality should have an impact on governance and systems and software. And of course, the local capacity enhancement should have an impact across all of these. So although we are divided into 4 strategic objectives, we very much see these as interrelated. So where are we working? Daniel mentioned a few of them in the introduction. And we've just gotten started in this, just past our first year. We are anticipating to be in more than 20 countries. This first year, we engaged mostly in 3 countries and 1 region, Burkina Faso, Niger, Serbia, and the Middle East and North Africa region. And we are looking forward to working and actively scoping our work plans for Indonesia, Mali, Malawi, Haiti, and Ghana. So you can see, although we are just getting started, we're already on our way to working on more than 4 continents. So that's a little bit about the project. I want to introduce you to a tool that I think some of you are familiar with, but it's called the Health Information System Stages of Continuous Improvement. This is an important maturity model and tool for the project because it helps us to track our own work as well as help countries that we work with identify where they are and chart a path forward, and then measure that progression. So I'll spend some time going into that before I dive into some of our work across these strategic objectives. So what we're trying to do is measure health information system maturity and evolution and try to address some of this issue of investments being made in strengthening health information systems and in digitizing, but having a hard time in the ability to measure, well, did things improve or not? So what we want to do is adopt a maturity model. In this case, we've chosen SOCHI to help track and document our program's performance, as well as help the countries that we work with benchmark and monitor their own progress. And it's a very collaborative process that brings many stakeholders together to assess the current state of a country's health information system, and then provide a measurable roadmap to health information system strengthening. So it's useful at a certain point in time to chart where you'd like to go, but then also to be used over the years to see, well, are you on track or not? And really help countries measure where they are progressing, where they are not progressing as quickly, and what some of those steps are that they would need to follow to move forward. So how was this tool, the SOCHI, developed? This was, like many tools, was developed collaboratively. The domains and stages were agreed upon through collaboration between the WHO Health Data Collaborative, Centers for Disease Control, Measure Evaluation. The domains on this tool are in alignment with the Health Information System Strengthening Frameworks developed by WHO, ITU, USAID, CDC, and others. Now, SOCHI fills a gap in some existing models. It's a model that works very well for low and middle income countries. And it's a comprehensive approach to addressing the essential components and elements of a health information system. It supports stakeholders to set a health information system maturity baseline status, as well as identify future goals and plan a path to improvement. Let's take a slightly deeper look at this tool so you can see what we're talking about. You can see there are the 5 domains: leadership and governance, management and workforce, ICT infrastructure, standards and interoperability, and data quality and use. And across these domains, we're measuring from 1 to 5, or from emerging to ad hoc, through defined to optimize, which would score a 5. These domains are then further broken down into health information systems components. So you can see under leadership and governance, we're looking for strategic plans, policy, legal, and regulatory framework and compliance, and health information systems governance and organizational structures and functions. And then these are further broken down into 39 different subcomponents for ease of tracking and to be able to see, identify clearly again what needs to be done and what needs to be done to move, to help the country progress in those areas. Looking at these stages, each of the components has their own rating in the tool, but generally I'll introduce you to these. So in the emerging or ad hoc stage, the formal processes for how to do something, whatever the domain is, are limited or emerging. Processes are not documented. The functional capabilities are at a development stage. And things are very much run on a project level or by individuals, but not by institutional means. As we get to the repeatable stage, moving up one, we can see that basic processes are in place. And the idea that standard processes and automated functional capabilities are needed, this is known. And the efforts to document current processes are underway. In the defined stage, now we're really starting to make some progress. And of course, with all of these, we're making progress. It takes significant work to move from one stage to another. But in the defined stage, things are now becoming more predictable. We have approved and documented processes and guidelines that exist. There is now collaboration and knowledge sharing that's been increased through engagement through technical working groups and sharing of experiences through the use of and deployment of different systems. And innovative methods and tools can be implemented and used to extend the functional capabilities of these systems. Now, as we move into stages 4 and 5, the managed and optimized, now we're really taking these tools and this foundation that's been built and really putting it into use. So we've now taken those processes and procedures, and we're actually using that to control in our plans, and using that to control and measure, are we following the plan? Are we following these procedures? We're checking to see that goals are developed and that they're met. We're collecting feedback on how these tools are being used and how these procedures are being followed. As we get into optimize, we are following all these standard procedures. We have organizational structures in place. We're sharing information. And beyond following the processes and standards that we laid out and strategies that we laid out and measuring those, we're actually actively learning from those processes and identifying, well, what types of adjustments do we need to make? And we're actually making adjustments to the procedures, to the strategies and plans based on the active monitoring and learning from this. So we're using the experiences and feedback to correct problems and continuously improve our processes and capabilities. And through this, we're also able to anticipate future challenges, and we're developing plans to address this through innovation and new technology. And we have processes in place not only to follow what we laid out maybe 2 years ago, maybe 5 years ago, but to incorporate relevant new information and innovation. So what is the health information system in the context of CHISU? The health information system is the entire health information system. It is all of the components and procedures that are organized with the objectives of generating information and using it to improve healthcare management, policy, and program decisions. Health information systems improvement is continuous, non-linear, and dynamic. And it caters not to just one specific system or one specific area like logistics, but to to the entire system, all of the systems that are components of the health information system, the routine health information system, the surveys, the labs, all of this. So we're not focusing just on a specific system, but on the entire ecosystem that comprises the health information system. So I have explained now for the project how we are organized across these 4 strategic objectives. I've also described SOCHI that has these 5 domains. And as you can see, these domains, strategic objectives map very well to the SOCHI domains. So we have health information systems governance that maps clearly to leadership and governance. The software and systems for our strategic objective 2 map very well to the ICT infrastructure and standards and interoperability. The strategic objective 3 around data quality and use maps very cleanly. And then strategic objective 4 around capacity enhancement of local organizations really maps to all of these strategic objectives. Management and workforce, yes, but also across all of these strategic objectives. So you can see the 2 fit very nicely together. So I have described these strategic objectives that we have. I've described our vision and described how we're using SOCHI to try to have a common framework to measure how we are doing. So it would be very nice and clean to be able to say, this is our one approach and this will work in each and every country that we're working in. But of course, we know that's not true. So we understand that each country is different. We're going to be working in more than 20 countries. Each country is in a different place. Each country has different goals and objectives. And so it is incumbent upon us as a project, as we are supporting the country ownership and country leadership of the health information system, to make sure we can support the country wherever they may be. So we anticipate then that countries will be in different places across these domains. Some may be very far in data quality and use, so maybe not as far in standards and interoperability. And we as a project need to be able to meet them where they are and to be able to work together. And so our support may vary then from country to country based on the country context and what we're asked to do. In some areas, in countries where they may be not quite as far, we may be doing more heavy hands-on support for basic building blocks. We may be building some of the systems. In other places, maybe things are more at a defined level. We may be providing limited hands-on support, working more with embedded staff and more focused on capacity enhancement. And all the way on the optimized side, things are working well, the systems are built, many processes are in place. We may be providing more of a light touch, technical assistance, advising for global guidance and integrating best practices. Throughout all of this, what we are wanting to achieve is to help countries recognize where they are, where they want to go, and to be able to take advantage of a lot of the global goods and health information systems innovations that are being made and being put out in many countries in the world, as well as at the global stage. And what we'd like to do is to be able to, where appropriate, use these global goods, work with countries to improve upon these global goods, and help countries move from being consumers of global goods to actually being the labs of innovation and the improvers and the contributors to the continued advancement of global goods, then sharing the use of these software and tools across countries to be able to improve the global community. Another component that I wanted to highlight in SOCHI, because it's quite relevant for our work under CHISU, is the importance of gender considerations. So you can see, of course, for a lot of discussions around gender, as we look in the middle, there is a need for gender and sex disaggregated data. And of course, we do look at that in SOCHI under the Health Information System Standards and Interoperability. But we're also looking to see within SOCHI if the strategies and legislation and standards have been developed using a gender equity lens. Through the national level coordination activities and team composition, looking to see that there's attention paid to gender and equity. We're looking to see that there's a gender-related component built into the health workforce training components. And we're looking that even in areas like data use, that on the guidance on the design and use of information products highlights gender issues, is documented and is available. So we feel that this tool really supports a number of the areas that we're trying to emphasize quite well. So let me dive in now a little bit more to these strategic objectives to what we've worked on so far. Looking at the first one, for strategic objective 1, which is our health information systems governance, you can see that strong health information systems governance depends on host country governance systems and organizational structures being strengthened, as well as the development and use of effective tools. So we're working to improve the governance processes, the health information system strategic plans, policies, making sure that we're having that link with local institutions like in strategic objective 4, and that we're improving the health information workforce and leadership, working to improve health human resource policies and adaptation of health information systems curricula. And that we're using effective tools such as maturity models to assess, measure, and chart a path forward for the health information system. So what does this look like now as we talk about some of the countries that we've been working in? In Burkina Faso, we've been supporting the One Health Technical Coordination Group. This is a group that's working to bring together many stakeholders to focus on One Health, across animal husbandry and the environment. And we work to define the terms of reference for the One Health Surveillance Commission. In Serbia, we've been supporting, providing support to the eHealth Steering Committee and been supporting the development of the eHealth Strategy and Action Plan. And the results of the SOCHI have been informing strategic planning that's been going on in both of these countries. Under the development and use of effective tools, I mentioned SOCHI. We have performed SOCHI assessments working with the government and other stakeholders in Burkina Faso and Serbia. This including assessing the status of technical governance structures for the National Health Information System. This covered all of the SOCHI components and brought out full participation from a wide range of stakeholders. Let's take a look at those SOCHI assessments in both of these countries. So in Burkina Faso, and you can see for these countries that although there were some similarities, some things are different, we applied the tool differently, but it still had a positive impact. So in Burkina Faso, there was a strategic plan, but it was ending as of the end of 2020. There was a new strategic plan that's being developed, and the SOCHI results then are expected to feed the new strategic planning process. For the stakeholder participation, you can see we had considerable participation, nearly half from the central level, not as much representation from the regional levels, but we did have health program representation from immunization, nutrition, HIV, and malaria, as well as implementing partners from Coopersmith and the USAID Momentum Project. You can see one of the things that we were looking at was also the gender balance. And here we had 93% male, 7% female. So as we move forward, we'll be looking to see an improved balance. We took a hybrid approach here. One of the key components for performing a SOCHI is bringing all of the stakeholders together to be able to arrive at consensus about where things are today and where we'd like to go in the future. So it's not just an assessment that's done and put on a shelf and you move on, but a big part of the process is really to bring people together who maybe don't speak to each other regularly and achieve that common view of how things are and where we'd like to go. So early on, we held multiple orientation and staff orientation meetings with the Ministry of Health. We then brought everyone together for a 6-day workshop. The first day was a training on the tool, then a local adaptation of the tool, and then getting into the data entry and analysis, breaking people up into 3 different groups. Standards and interoperability and data quality and use were some key areas of focus, so they had their own groups that were focused just on that. In Serbia, again, same tool, but a different process. Here, the eHealth Strategy Committee was led by the Prime Minister's Office. The scope, again, was the National Health Information System. And here we had between 28 and 40 participants in each of 3 workshops. Now, these workshops were coming together to work on the development of the eHealth strategy. So SOCHI fit in as a component to one of these. We had more than 50 stakeholders participate in at least one of the workshops. And as you can see, we had good gender balance there with just a few more females than males in the group. We had representation from the Ministry of Health, other government agencies, the private sector, NGOs, and education, other civil society and international donors. And here we introduced the tool at one workshop. We then used a small group to produce a draft SOCHI, and then this was validated through all of the stakeholders in the next 2 workshops. So different ways of using the tool and coming up with consensus, but again, the important thing is using the tool and bringing people together to arrive at consensus. So moving on to strategic objective 2 on the systems and software side. This is what we're looking at for systems and software. We're focused on data availability, we're focused on interoperability, and we're focused on the technological advances, tools, and data science approaches. So our vision for strategic objective 2 is robust availability of quality health data generated by information systems at scale and meet the needs of users, including meaningful data exchange and analysis and visualizations that facilitate decision-making. So under data availability, when systems are deployed at scale, they should provide data for key indicators without duplication and have sustainable governance processes as well as data standards. For interoperability, this is where the interoperability solutions should be supported by the necessary standards for exchange and security. And where countries may not be ready for interoperability yet, readiness assessments should be done to prepare them for this next step. And under 2.3, the technological advances should be working to enhance the capacity of local partners to support countries to use innovative data science approaches to derive complex analyses and useful visualizations that facilitate decision-making. So looking again at specific examples of what we've done, in Burkina Faso, using the One Health information system, we enhanced the system to be able to enter the COVID-19 test results from labs and capture COVID-19 vaccine tracking and vaccination records. We also supported ENDOS, the National Health Information System based Health Management Information System based on DHIS2, as is the One Health Information System. And we scaled this down to the health facility level in the Center-West region and also enhanced the system through the inclusion of the WHO Data Quality Review module. Another tool that we developed was the high-performing healthcare tool. This is a tool that was initially developed through the Office of Health Systems, and we digitized, tested, and launched this tool in May of 2021. This is a tool that's available in English, French, and Spanish, and helps provide data on perceptions of the health system from a variety of stakeholders. And we're looking at this through the lenses of accountability, affordability, accessibility, and reliability. And I've included the URL here so you can see the tool yourself. One of the things about this tool is that it's possible to use this to receive input from, again, a variety of stakeholders, but then also disaggregate this data by the stakeholders. So by geography, by the stakeholder type, education level, gender and work experience. So you can use this data combined with other data sources, such as the routine health information system, to be able to see the service delivery statistics, yes, but also to see, well, how do people feel about the services that they're being provided? What are their attitudes? And is this the same for everyone? Or are certain people in some geographies or some demographic groups feeling one way more positive or less positive than the other? So this tool can really be used to support better decision-making by the stakeholders. Under strengthened interoperability of systems, in Burkina Faso, again, we're supporting the One Health information system, which pulls together data from 3 different information systems or 3 different ministries into a single system for analysis and uses an interoperability layer. Now, this investment in the interoperability layer can be used for other things, of course. And so we work to enable interoperability between the One Health system and the Rapid Pro community data management system. And this interoperability layer also enabled transmission of COVID-19 test results from labs to an application developed by the Ministry of Health, which then sends the results by SMS to clients. And we also supported the initiation of the design of the enterprise architecture. So I wanted to pause here and highlight a success story. Because it's easy to talk about all these tools and these high-level things. But this example in Burkina Faso of being able to have travelers receive their test results via SMS I think brings together so many nice elements. So one, it's building off a prior investment in an interoperability layer. So it shows that investment in these foundational tools can really be leveraged. The system that's being used was actually developed by Ministry of Health staff, not by CHISU staff or another development partner. So this is great. This shows the government ownership and capacity. Results are available through QR codes. The waiting time to receive results was reduced by 24 hours, which may not sound like much, but you remember that these are test results that people need when they're getting ready to go on a plane. So this 24 hours is a very significant component. And in addition to reducing the waiting time, because people can receive their results via SMS, they don't have to go back to the health facility in the middle of a pandemic to stand in line to receive their test results, spending additional time and potentially additional exposure. So we've had over 60,000 results shared in 2021. And this story, this success story that we had highlighted here, this was based on an interview with a businessman who is now able to travel more freely and more regularly, taking his business to other countries in the region that he had not been able to do nearly as easily or effectively without this tool in place. So it actually shows how investments in some of these foundations of the health information system can actually improve economic activity. Let's move now to strategic objective 3. So this is around data quality and use. So we're focused on the health workforce capacity and organizational processes. We're focused on the use of health data, data analytics, visualization, and interpretation. So getting down again back to the specific examples. For the health workforce capacity and organizational processes, in Burkina Faso, we trained health facility agents and community workers in events-based surveillance, and we developed a role definition matrix for data users of the One Health information system. We strengthened the use of Endos, as I mentioned, installing the WHO data quality review module in Endos, but also held workshops orienting central health information system staff on the use of this tool. Under data analytics, visualization, and interpretation, in looking at the One Health information system, we have an interesting example to share. The system pulls together information again from a variety of sources, and using the system, the regional office of the animal resources alerted the central One Health ministries of a mysterious death of fish and cattle in a village. And the committee that was in place came together, acted on this information, and actually went out to visit to conduct a joint investigation to get a firsthand look at the issue. And so you can see now as this is the regional governor receiving the central level team, and the team actually going out and taking samples for further analysis. Additionally, we're supporting the Ministry of Health for a weekly analysis of epidemiological data, which has been used to identify abnormal case counts in cholera and dengue, and enable the Ministry of Health to take corrective action to try to address those. Another component we wanted to mention, although we were not specifically focused on this in the data use side, was actually back to SOCHI and how the use of SOCHI can strengthen what was being done in Serbia. So in the development of the health information system strategy, when we were first coming in to work, there were limited focus on data use. But then as SOCHI was introduced, and we really dug down into that data quality and use domain, the next iteration of the draft that the stakeholders, the more than 50 stakeholders came together to produce, had a new objective focused just on data use with a series of activities to support progression. The last strategic objective I'll talk about here is around local capacity enhancement. And here you can see that we're focused on strengthening and enhancing organizational capacity, technical capacity, and financial management. Through group training, technical assistance, learning visits, as well as the digitization of some assessment tools. So here, although we've been been getting started, we haven't done as much work here as in some of the other domains, but we have been doing a fair amount of technical capacity enhancement. So again, the use of the SOCHI and the orientation of stakeholders in Serbia and Burkina Faso on how to use the tool. We've started the inclusion of the data quality review process in Burkina Faso and working with stakeholders there. the training of health facilities agents and community health workers in events-based surveillance, as well as working on mentorship on using the SOCHI is being planned in Serbia and Niger. A few describe the four, excuse me, the four strategic objectives. I wanted to take a moment to talk about some of these cross-cutting issues: gender, using global goods, and privacy and security. So this again is our overall theory of change. And what we see here is how gender really supports all of these. And it's a backdrop for all of the work that we do in CHISU and in each strategic objective. So we developed a gender plan. We hosted a gender-focused webinar, bringing together various stakeholders from around the world, talking about the importance of gender and health information systems. We meet with each country team to provide a detailed orientation, review their work plans, and identify key action items that can be taken to move the needle on gender issues in each of these activities. And we also developed a gender consideration guide to support country teams in integrating gender into their activities. This is just a quick snapshot as far as what the tool looks like. So you can see it's really a series of questions that can be asked depending on the types of activities that you're looking at. So if we're supporting leadership and the development of leadership and guidance, then we should look at things like examining gender ratios in decision-making bodies, supporting leaders to develop their own gender awareness, support existing decision makers to increase demand for gender data. And so we have been using this tool now in each of the countries that we're working. I wanted to talk briefly about global goods. For CHISU, of course, we are supporting the country health information, the country to use the tools and the systems that it already has. And where new tools can be brought in, we're advocating for the use of global goods, but again, they need to be appropriate for the context. So the global goods here, we tend to promote and support the use of global goods where appropriate, and also to really help countries provide feedback on the global goods, whether they work, whether they don't work, or there are some pieces of them that work, so that they can be improved for everyone's use. So here with global goods, we're talking about software, tools, and frameworks. So some of the global goods we've been working with are, of course, SOCHI, the stages of continuous improvement, and then working with DHIS2 and Rapid Pro. And again, providing feedback back to the developers of these tools on how these systems are working and tools are working for the country stakeholders. We're also looking forward to further use of these tools, particularly DHIS2, although we've used in Burkina Faso, but other countries will be working in where we will be likely supporting DHIS2 will be Niger, Haiti, Malawi, Mali, Indonesia. On the data security side, this is of course becoming increasingly important, and we've been incorporating this into the systems training in Burkina Faso for health facility end users, as well as highlighting the importance of privacy and security in the SOCHI domains, looking at health information systems policies, the policy compliance, and the data security exchange. And then for global engagement, I talked about the team that was needed to be able to support this effort. We have a large team, a good team, but we need to work with everyone. So we really actively engage with a number of working groups and networks to be able to share our experiences as well as identify tools and partners in the countries that we may be working. So we particularly work with the Health Data Collaborative working groups, with the WHO Monitor, regional health information systems networks like AHIN and ACFI and RICAINSA, of course, and RHINO, the Routine Health Information System Network. And we really work to bring those country experiences back to these groups, as well as then bring some of these other experiences and new tools that are being developed to the countries that we're working, and really encourage the countries to engage. So looking ahead, and I know I just have a few minutes here, and then I'm really looking forward to the question and answer. So in addition to continuing our core work in the countries where we are working, as well as the countries that we are scoping on our way to more than 20 countries, we will be supporting, doing work across all the strategic objectives in the current and new countries. But we also have some new work coming up. We will be developing a digitized or enhancing a digitized version of the SOCHI, enhancing the web-based version to facilitate the storage and sharing of results and cross-country learnings, to help move along in the data use and analytics component, we'll be developing an artificial intelligence and machine learning knowledge hub. We'll be developing guidance for digital supportive supervision. And again, continuing to support the core work across our current and new countries. Looking at some of the cross-cutting activities looking forward, again, we'll continue to have active participation in the working groups. We'll be continuing to collaborate with WHO and regional WHO bodies like AFRO, PAHO, looking for collaboration and alignment opportunities at country and regional level. We'll continue to focus on gender and the important gender lens and components across our activities. We'll be improving, working on mentorship and continuing to use SOCHI, and also continuing to use other global goods like the DHIS2 Action Tracker, the WHO Data Quality Review Module in Burkina Faso, and other countries. So I've given you quite a lot of information, perhaps too much, but I did want to share a way to learn more about CHISU if you'd like. So you can see our information there across a variety of channels. And I did also want to highlight our YouTube channel where we've been recording a series of chats with CHISU on a variety of topics, as well as recording webinars with stakeholders across topics relevant to this domain. So with that, I will say thank you very much. I really appreciate your time, and I'm looking forward to hearing from you all. Thank you.
Thank you, Steve, for this amazing presentation. This is definitely a project that we need to keep an eye on it. And we have a few questions for you.
Sure.
The first one is, based on CHISU's successful experience in Burkina Faso and your knowledge of the situation globally, do you think it could be successful for low and middle income countries in Latin America?
That's a great question. I'm going to say, yes, I think so, but I will make an important caveat in that I think every country is different, and this is important. However, I think there are some common challenges. I think what Burkina Faso is a good example of is investing in some foundational components, having strong leadership, having a strategic plan, investing in an interoperability layer instead of point-to-point connections, and having strong governance through technical working groups to be able to reduce duplication of systems. This helped Burkina Faso then when COVID hit, as it hit everybody within a very short period of time, to be able to leverage those investments in these systems and interoperability to then support their response. And I think this is a very relevant component. So I think, again, it shows how these investments in these foundational components, sometimes they're not so exciting for people to fund. People like to build new systems and tools and roll out systems across everyone. And that's very important, but it shows how these investments in foundational components will put country health systems in a much stronger position for what they know is coming and for what they don't know is coming. But you know that if you have connectivity, if you have interoperability, if you have standards and governance, and you have some core systems to build from, then you're going to be a much more agile and resilient health system. So I think that at least is an applicable lesson, I think, for many countries.
Thank you, Stephen. For those who didn't listen to the question in Spanish was based on CHISU's successful experience in Burkina Faso and your knowledge of the situation globally, do you think it could be a successful for low and middle income countries in Latin America? Thank you, Steve. And I have a second question for you.
Certainly.
What was the key to making CHISU such an inclusive project?
That's a good question. That's a good question. I think it really comes from a variety of places. I mean, one, this is a USAID funded project, and USAID and the US government has really made a focus on equity and inclusivity in all of their programming. And I think also then for us as a management team, which I'm fortunate to have a wonderful management team. I wish they could all be here presenting with me, but across a management team and partners to really make sure that we weren't just checking a box, but this is something that we firmly believe in, that there are a lot of things that we would like to see done differently in health information systems and digital health, and really believing that making the process of using and developing and governing these tools more equitable and inclusive is something that's very important. And so we've really taken it to heart, but it requires continuous discussion and requires an open environment where people can feel free to say, hey, that thing that you just said, that activity you planned, did we think about gender? Did we think about inclusivity? And sometimes you don't. And so it's very important, as much as you try to plan, to make sure that you have a strong team around you that feels confident and able to point this out and at least continuously ask the question, how can we do this better?
That is fantastic. We all know that the more people you bring, the best results we're gonna get. And I have a last question for you.
Sure.
Change management in this type of projects is fundamental. Tell us how you achieve it and what will be your recommendations.
Yeah, that's really important. And I think it goes back to some of the things that we've been talking about. It's about involving many stakeholders in the process, because if you are developing a strategy with a small group of stakeholders and rolling out new policies and procedures, you may be just getting the views of a few people. Maybe this is a group of people that all happen to think alike. But really, when you're working in a health system, you're asking everybody to change. You're asking clients to change. You're asking health workers to change and health systems managers. So it becomes increasingly important to bring together many stakeholders to look at the policies and procedures, look at the systems that are being designed, look at how the data is being used, and look at how feedback is being collected. I think it's easy to think about, well, let's do change management at the beginning and make a plan, but to continue to monitor how different stakeholders are being impacted by these new tools and innovations and processes, and see how things can be adapted. Because of course, you can't know everything at the beginning. We like to think if you make a perfect plan that we'll be all set, but the reality is we need to continuously engage in change management.
Thank you, Steve. And you have 2 minutes to close your participation. Thank you.
Great. Thank you very much. Well, I will take the full 2 minutes. I know there are many other agenda items, but I just wanted to say thank you so much to our friends at Rekainsa. I really appreciate the opportunity to speak about CHISU. I look forward to participating with you all on the continued global organizations that we work in, and as we work together to continue to improve and strengthen health information systems for the countries that we're working in, and to continue to work across geographies and see what we can learn from each other as we all work to navigate the space.
Thank you, Steve. And now I will change from English to Spanish.
Thank you.
Muchísimas gracias a Steve Ollis, un amigo de Rekainsa, un mentor para nosotros, y como lo hemos dicho siempre, sin su apoyo, Rekainsa no estaría donde está. Así que, bueno, hoy hemos tenido una jornada muy extensa, más de 200 participantes en las distintas actividades. Tuvimos 2 conferencias magistrales, hablamos de seguridad de los datos, de ciberseguridad, hablamos de expediente clínico electrónico, tuvimos un interesante panel del rol de las farmacéuticas en los temas de transformación digital en salud, hablamos de código abierto, de open source, y bueno, mañana arrancamos nuevamente en punto de las 8 de la mañana y bueno, vamos, para adelantarles un poco, vamos a tener igual 2 conferencias magistrales. Vamos a estar hablando de un tema muy importante y que Steve fue muy enfático en el tema de gobernanza de datos, un tema que todos deberíamos tomar en cuenta. Vamos a hablar del poder de las redes de salud digital para el intercambio de conocimiento y experiencias y buenas prácticas. Este va a ser un panel muy especial para nosotros, pues vamos a tener en casa amigos muy especiales de las otras redes de salud digital a nivel mundial. También vamos a estar hablando de gestión del conocimiento e investigación en salud digital, así que no se lo pierdan. Y también tendremos un tercer panel sobre oferta formativa en salud digital. Vamos a hablar de los avances y de los retos que tenemos en nuestra región en torno a este tema. Y finalmente, para cerrar con broche de oro, vamos a tener la extraordinaria participación del doctor José Francisco García Gutiérrez, quien va a hacer una ponencia sobre recursos humanos en salud. Vamos a hablar sobre nuevas competencias para el nuevo paradigma de trabajo. Así que muchísimas gracias a todos por estar pendiente de todas y cada una de las actividades que desde Recainsa hemos preparado para todos ustedes. Sigan pendientes de todas las actividades que se están realizando alrededor del mundo en el marco de la Semana de la Salud Digital. Muchísimas gracias. No se desconecten todavía. Vamos a pasarles un video y los esperamos siempre mañana en vivo a través de nuestro canal de YouTube. Sigan pendientes de las redes sociales porque estamos haciendo actualizaciones permanentemente de todas y cada una de nuestras actividades. Luis, por favor.